Namaste, I'm Dr. Anushri Muralidharan from Divineveda. Today I'm here with my second video of asthma. In my previous video, I discussed about signs and symptoms, exacerbation and its symptoms, worsening of asthma and how to identify it, early warning signs of asthma attack, type of asthma based on its occurrence and its severity, risk factors and diagnosis. Link of that video is given in the subscription box below. Please do watch. In this video, I am going to discuss about usually given treatment and its adverse effects, relevance of Ayurvedic treatment in curing asthma, Ayurvedic perspective of asthma and its Ayurvedic treatment, Patya and Apatya, that is do's and don'ts. I think this video will be helpful for anyone who wants to know about the treatment options of asthma in Ayurveda. So please watch this video till the end. Let's start the video. Usually given treatment. Usually given treatments are quick relief treatment. Quick relief treatment include medications that can be given during asthmatic flare-up to provide an instant relief and to help in easy breathing. Combination inhalers. A much prevalent and commonly done practice were corticosteroids and long-acting beta agonists is made to inhale together to relieve the symptoms. Short-acting beta agonists, called rescue medicines or rescue inhalers, are used to loosen the muscle tightness, thereby enables proper airflow. Long-term asthma medications like long-acting beta agonists are also prescribed by some doctors. These medications are for relaxing the airway muscles. These medications are bronchodilators. It is usually given in combination with a corticosteroid. Allergy shots are taken in order to make you less sensitive to a particular allergen in order to ease your symptoms. Leukotrienes are inflammatory chemicals released by our body which triggers asthma or allergy by tightening the airway muscles and producing excess mucus. Leukotriene modifiers are medications that reduce the inflammation and relaxes the airway muscles. Biologics are advanced medications which are usually given as injections to people with severe persistent asthma. Theophylline also helps in relieving chest tightness. This is taken for a long term, usually by mouth or through inhalation, along with the corticosteroid. Bronchial thermoplasty is a treatment using electrodes which heat the airways inside the lungs, which in turn reduces the muscle tightness. Now you may have understood all the currently taken medications are for relaxation of airway muscles and taken along with corticosteroids. It is a very much known fact that regular use of corticosteroids are harmful for health, and relaxation of airway muscles and bronchioles are also not conducive for the body. This is where Ayurveda treatment and medication plays its role. Ayurveda focuses on intake of medication for strengthening the airway muscles and channels permanently rather than relaxing it every time when an asthmatic flare-up comes. Ayurveda also emphasizes on regulating and limiting the causative factors, intake of causative food and drinks, and exposure to causative activities and unconducive practices in order to cure the disease from its root permanently and to prevent its further attack. Ayurvedic perspective of asthma and its Ayurvedic treatment. Asthma can be correlated to Shvasaroga symptomatically, which is a Pranavaha Shrotovikara. It is a Vada Kafaja Roga, that is, disease caused due to vitiation of Vata and Kapha simultaneously. Vata Prakopa or vitiation of Vata is due to food and activities which increase Vata inside the body. Intake of dry and cold foods and living in cold weather, cold water bath, exposure to cold wind, and excessive physical exertion increase Vata in the body. Kapha Prakopa or vitiation of Kapha is due to intake of sweets and sugar, dairy products, banana, eggs, milk, curd, black gram, cold foods, etc. Excessive day sleep and exposure to cold weather also increase Kapha. Accumulated kapha causes srodhavarota, that is, blockage of channels and airways, which lead to obstruction to the movement of vata. When both vata and kapha aggravates in body, movement of vata will be blocked by the accumulated kapha, due to which vata will move in pradiloma gati or retrograde motion. This condition is called as asthma. That is why it is called as vata kaphaja roga. Here, treatment is done in order to subside both vata and kapha simultaneously. Treatment of asthma is quite difficult because both vata and kapha have opposite properties. When vata decreases, kapha will increase. So, treatment should be very careful with appropriate medicines and therapies to reduce vata and kapha together. Along with medications, strict patya should also be followed. Now, let us move on to the types of shwasa. There are 5 types of shwasa. Shudra shwasa, that which subside by itself. Mahashwasa, heavy breathing. Urdhva shwasa, prolonged and upward breathing. Chinna shwasa, interrupted breathing. Tamaka shwasa. The symptoms of tamaka shwasa mentioned in classical text is very similar to that of bronchial asthma. So, tamaka shwasa can be correlated to bronchial asthma. Ayurveda also mentioned about occupational asthma, exercise-induced asthma, diet-induced asthma, and hereditary predisposition of asthma. Some very important anti-asthmatic herbs are also mentioned in Ayurvedic classical texts. Vasa, Kantakari, Shunti, Maricha, Pippali, Tagara, Yashtimatu, Rasna, Tulasi, Pushkaramula, Vamshalochana, and Nakakesara. These herbs and formulation made from these herbs as prime ingredients are found very effective in curing asthma. Now let us see some anti-asthmatic formulations as well. Talisati Churna, Sitopalati Churna, Vasavaleha, Shwasakutara Rasa, Shwasanandangulika, Vasarishta, Kanakasava, Elakanati Kashaya, Nayopayam Kashaya are few very famous medications in curing asthma. But simply taking these herbs and medications won't give effect. An expert physician will be able to choose the apt herb or apt medication after assessing patient's condition, vitiated dosha, prakriti of the patient, and the severity of the disease. Some cleansing therapies are also done to eliminate the accumulated kapha from the body and to pave way for the proper movement of vata. Cleansing therapies include Vamana or therapeutic emesis, Virechana or therapeutic purgation, Svetana or fermentation therapy, etc. Some other therapies are also required after assessing the condition of the patient and severity of the disease. Patyas and apatyas, that is, do's and don'ts. Substances like rice, wheat, green gram, horse gram, barley, vegetables like bitter gourd, snake gourd, garlic, turmeric, ginger, black pepper, long pepper, honey, goat's milk and lukewarm water can be consumed. Whereas intake of black gram, too much fruits, especially bananas, sweets and pastries, eggs, refrigerated foods, cool drinks, dairy products, intake of too much cold water and day sleep should not be done. I hope this video has given a superficial knowledge about the various treatment options for asthma in Ayurveda. If you want to know more about asthma, its natural remedies, precautions to prevent asthma, yoga and pranayama for asthma, please do watch my upcoming video. If you enjoyed watching this video, please do like the video and comment your opinion and suggestion in the comment box below. You may also comment any health issue or disease which you want me to discuss. I'll try to come up with videos for the same. We, Divineveda as a team, are on a mission to create awareness about Ayurveda, yoga, diet and lifestyle correction through YouTube and other social media platforms like Instagram and Facebook. I take this opportunity to thank you on the behalf of Divineveda for the immense love and support you have given us in our journey. Continue watching the videos from Divineveda and keep supporting us. Thank you for listening. This is Dr. Anushree signing out.